Is dying an option or a choice? Due to the lack of attention this controversial topic has received in the past, I'd like to inform my audience today known as what can be called euthanasia or assisted death. My reason for choosing this topic would be I wanted to research more and I was curious about the opinions of others that they had on this topic. I also really wanted to inform my audience and encourage them to look more into this topic because I feel it is something we should talk more about. It is a sensitive, morbid thing to take into account and converse about, but overall, it's something that we need to bring out in the open and we need to have an adult conversation about. The pros and cons I found to this were very interesting, along with the sources that I got my information from, which are reliable indeed. The first pro was, or point, many individuals with severe terminal illnesses and diseases found that it was a better way to go if they knew really that they were going to be experiencing discomfort, pain, and it was just a way to end that physical discomfort and pain rather than going through it 24/7, especially if they knew they had a set amount of time to live, which was usually between 6 months or less. About the statistic I found on that was about 63.1% of cancer patients, which were between 69 to 89 years old, went through with assisted death. I also found an article on an old couple that found out they were diagnosed with prostate cancer and the other with Parkinson's disease. They both came to the conclusion and found out, along with finding out that they both had only 6 months to live, or less, which was what the doctor told them. With that being heard, they decided they wanted to both take the lethal dose and pass with each other rather than suffering and going on with this terminal illnesses and experience this pain 24/7. They felt it was their time to go. They both made a decision, which was a mutual agreement. Although their family wasn't very agreeing on it, they just asked that they respected it, and the family tried just their best to do so. Also, to add on that, the doctor, the physician, told them that there was really no chance of them being cured over time. So that was really a big factor in their decision. This is really important to remember that when people make this decision, it's when they're really experiencing deep pain and they want to feel comforted in a way knowing they can be in control of how they deal with these conditions. So, Pro 2, this is all based on a matter of personal preference. It's what they really want to decide. A doctor who's named Robert Klitzman said, at a certain point, the suffering of ongoing treatment does not constitute a life worth living. Policymakers and voters should allow patients to have this option in carefully specified and monitored circumstances. I hope, too, that if I ever had to confront this decision, I would be allowed to make a choice. It's all done with good reasoning, with the individual choosing medical aid and dying when they're suffering from a terminal disease. The cons, con 1, many people are concerned with how it influences and corrupts the practice of medicine. So that's where I talked about a doctor, a physician takes an Hippocratic oath. The quote I found from an article I cited was an anonymous doctor said, euthanasia kills the patient twice. Once when we say, yes, your life is not worth living, and then when we help him die. A peer testimony by Avram Steinberg spoke about ethics and values, including such a thing as PAS. He said, a physician is not an executioner of society. His role is not to kill people, it is to care for people. And that's where the controversy really comes in with the doctors opposing that because of the Hippocratic Oath. I mean, it goes against all their values and everything they were told. Con 2 is lastly, families feel as if they're being compromised with and going against, like, you know, that individual's value, you know, the values that the family has and that they're committed to, and they feel as if they're going against that, like, you know, it's assisted suicide. And so it really brings up a big controversy right there. But, I mean, you know, family members were interviewed, and they found that 11 in 100 had some form of depression, and 2 in 100 still had some symptoms of grief, which were the families that experienced that after the passing of their family members that went through with euthanasia. Overall, the temptation to view elderly or disabled family members as burdens will increase, as will the temptation for those family members to initialize this attitude and view themselves as burdens. So it makes them wonder as, did they do this for another reason? Did they go against the values of this family? You know, all in all, I just wanted to really inform everyone, my audience, the pros and cons involving euthanasia or medical aid in dying. As I stated earlier, the reason being for choosing this topic is to better my curiosity and my understanding on this and wanting to shed more light on the topic. The 2 pros and 2 cons I presented in my speech today are only a few of the main reasons why people in the United States think that physician-assisted suicide should be illegal. I hope that all of you have learned something and that you will go more in research into it and not be afraid to talk more about this.